natural ways to beat fungus. Do you have questions about fungal infections, like who gets them, where do they happen, is it a toenail fungus, a chronic sinus infection, a respiratory disease, and what are the treatment options and how can you prevent it? So after watching this video, you'll know the 4 types of infections, how you can avoid fungus, you know the difference between yeast, candida, and fungus, and what treatments are available, and the 6 solutions for treating fungal infections, and as a bonus, the 4 advanced therapies for candida, yeast, and fungal infections. Hi, this is Dr. Jason West in the West Clinic, and 4 generations, 100 years of healing with me, and now before I go on, I need your help. I want you to help as many people as possible, a cause, to help people achieve and maintain optimal health without going to doctors, without unnecessary drugs, without unnecessary surgery or aggressive interventions. And the value that I bring to you is that the information and the report that goes with it. And in return, would you please like and share the video? Thank you for doing that. I was asked yesterday by a patient, what can you do about infection? I replied, what type of infection? Because there are 4 types of infection. There's bacterial, there's virus, there's parasites, and fungi. And after the discovery of antibiotics, it seemed like everyone assumed infections were bacterial, and we just hammered people with antibiotics. It was called the wonder drug. The dictionary defines anti meaning fighting, or opposed, or against, and bios is the Greek word for life, so it literally means life-killing therapy. Now, I'm not anti-medicine, but I feel you should use antibiotics cautiously because they can be life-saving, but they can also have some detrimental side effects to your health. And I need to talk about side effects. Drugs either have effects or they don't. There's no such thing as a side effect. Okay, I have seen hundreds of patients with the effects of antibiotics, and often antibiotics are the cause or the contributing factor of the chronic yeast or candida infections. So let's talk about yeast and mold and mushrooms. I mean, who really eats those? I mean, we need an MRI scheduled to your brain if you're a fungus or mushroom eater. Now, I say that jokingly because I don't like the taste of mushrooms, but it's a proven fact that people that eat mushrooms eventually die. Okay, I'll drop the comedy act. I just have an aversion to mushrooms. I mean, do you know that they grow on? Seriously, it's poop, okay? All right, never mind about the fecal living organisms. The video must go on. Really, this is a good place to talk about the definitions because mold, yeast, mildew, they're all fungus. The word gets used interchangeably, and many times people will talk about yeast, candida, or candida fungus, and to describe the same thing. Now, yeast are unicellular fungi, while fungus are made up of long tubes of hyphae. It's like basically a bunch of them. And candida basically is the precursor to yeast. It's kind of like a butterfly. So it's just different life cycles of the organism. Now, there are different areas that the yeast or candida fungus, the monster, likes to go after. You can have skin problems like athlete's foot, jock itch, fingernail or toenail fungus, and ringworm. And why is this such a problem? Because Americans unintentionally fertilize the yeast or the candida. And who does that? It's because the American diet is filled with so much sugar and simple carbs. That's one way to address the problem. If you starve the fungus, you'll start feeling worse because it's releasing toxins, and the natural thing to do is to start eating sugar, and then the yeast laps up and it's sugar, and then you feel better. But your conditions stay the same. So yeast and candida multiplies, and it makes us crave sugar. That's why it's such a difficult thing to take care of. And how do you know if you have a yeast problem? Well, one clue is the symptoms. Things like oral thrush, fingernail or toenail fungus, vaginal yeast infections, or even patches on your skin, your respiratory system, and can get into your lungs. There can also be systemic candida, which can get into your muscles, your lungs, and your brain. Now, I believe candida is a huge contributing factor to fibromyalgia and chronic fatigue syndrome, or the new name, systemic exertion tolerance disease. I mean, that sounds way better than chronic disease. Now, a lot of medical practitioners don't believe in candida or systemic candida, like it's some type of religion or something. And like Will Rogers' statement here, there's 2 sides to every argument, mine and the wrong one. So a lot of medical practitioners, they just miss the boat on yeast and candida. Now, the medical practitioners who do recognize yeast problems may be treating them wrong. Many antifungals affect liver and kidney function, and especially if you mix the antifungals with alcohol or another drug therapy. And antifungals weaken the heart's ability to contract. This can lead to heart failure, and the medicine that the antifungals react are usually common prescriptions or over-the-counter medicines. Now, fungus are microorganisms that are present everywhere. indoors, outdoors. In fact, there's over 50,000 types of fungi in the environment. They can coexist or live on your skin for years without a problem. But sometimes a change happens and then the infection occurs. And it can be ringworm on your head, or nail beds, or candidiasis. It can be in the mouth, the vaginal tract, or the urinary tract. Now, it's kind of a trick question at the beginning of the video because it says, how can we avoid fungus? How can you avoid mold? And the answer is that you can't. The way that you don't have those infections is you've got to make sure that your immune system's healthy and you don't intentionally feed the candida. This can be brought on by a weakened immune system, side effects of antibiotics, diabetes, poor hygiene, warm and moist environments, poor circulation, or a traumatic skin injury. So let's talk about something that's really important. If you're having fungal concerns or problems, it's a sign that your immune system isn't working. Let me repeat that. A fungal infection is a sign of a deeper problem. And you can't avoid fungus or yeast or mold spores. They're everywhere. And the immune system takes care of them when it's healthy. If you have immune system deficiencies or lifestyle problems where you're unintentionally just feeding or fertilizing the yeast, and then this thing called stress. Now, stress, too much sugar, not enough sleep, an empty calorie diet. What? That means you can get food space takers. Now, what does that mean? It means that you can get food in your system that's of no real substance. In my opinion, the only long-term viable solution for a chronic yeast or candida infection is to work on the person and not the yeast. You must change the environment and make the person healthy. Relying on a pill or an antifungal medicine, I believe, is a recipe for disaster. So let's talk about solutions. Here's the best way to treat these types of infections. Number one, remove the food source. Stop eating food cocaine. Now, I say that because it sounds cool. And everyone says sugar is more addictive than cocaine. So avoid sugar. Apple cider vinegar helps to kill fungus infections, and the acidic properties helps to kill the problem. You can use it externally and you can use it internally. And for systemic conditions, I really like plain yogurt, not sugar-fied yogurt. I love garlic because it helps to kill the fungus, the bacteria, and the yeast. And oils like tea tree oil, oregano oil, peppermint, and clove oil. Now, my favorite thing to do for antifungals candida yeast is a natural Native American remedy called lomatium. It's a wild-crafted herb originally discovered by the Native Americans that bolsters the immune system. And I believe it's the number one remedy for fungal infections, for yeast problems, and for systemic candida. Now, there are two ways to get this. You can get it as a tincture or as a capsule. And this is particularly effective against fungal skin infections because it literally burns up the fungus. And it leaves your healthy tissue intact. And you rub this on your toenail or your fingernail, and it really, really helps that type of fungus. But I must urge you, it's consistency. If you treat those areas consistently with Lomatia, it will help in my experience. Now, you have to figure out who is more determined, you or the fungus. So you take the Lomatia, you rub it on your toenails and fungus, and you can order through that. You can order that through the West Clinic online or Nature's NX. Now, for the people that are not responding to the home therapy, there's some advanced therapies that are important to help your immune system. Number one, vitamin C. It strengthens the immune system. It's my favorite overall vitamin. You may want to couple that with ultraviolet blood irradiation therapy or UVRX therapy, and then dilute hydrochloric acid. A 1 to 500 dilution has some fantastic immune stimulating and some lymph node flushing therapies. And then neural therapy helps to reset the nervous system. I talk about this on almost every video because it's literally life-changing. So to summarize the information, you can't avoid fungus, you gotta be healthy. If you have a fungal problem, it's a sign that your immune system isn't working that well. And antifungal medicines interact with common prescriptions and over-the-counter medicines and are very hard on the liver and kidney. The only way to win against a candida or yeast problem is to make the body healthy. It's kind of like the Humpty Dumpty plan. You're on a wall, you fall off, you're in pieces. You have to have someone help put the pieces back together. To beat this, you need to follow the candida diet. And by the way, as a bonus, if you'll message me, I'll send you my favorite candida diet outline. And then Lomatia is the best treatment for candida systemically, in my opinion. You can put Lomatia directly on the skin areas, your fingernails and toenails. It works great as long as you're consistent based upon my clinical experience and the feedback that my patients are giving me. And then some people with candida, long-standing yeast and candida infections, the only way, in my opinion, to beat those is to do the IV vitamin C, some type of ultraviolet therapy, and possibly some dilute hydrochloric acid therapy. Thanks for watching the video. This is Dr. Jason West in the West Clinic. There's always hope, and our mission is to help as many people as possible to achieve and maintain optimal health.